Let's start today with something special. We're going to begin a one-year-long series of stories focusing on the 50th anniversary of the Health District, sort of a trip down memory lane on Shadow Lane. For longtime residents, a sense of nostalgia, and for those more recent arrivals, some answers to how things we take for granted here in Las Vegas and Clark County actually came to be. Times do change, and somehow here in Southern Nevada, those changes over the past 50 years seem much more vivid than in other communities. For whatever reason, it's really difficult to capture the essence of and truly do justice to those men and women who managed to create some sense of order in what was truly a frontier town mentality just 50 short years ago. But around here, back in the late 1950s, our community safety net had its own unique and somewhat haphazard way of taking care of business. In 1959, the state enacted legislation creating the Clark County Health District, bringing all the residents of Southern Nevada under one unified public health authority, even if some weren't too pleased with the idea. And by 1962, the brand new Clark County Health District was up and running. Since then, just 3 men have been at the helm of the Health District: Dr. Otto Ravenholt, Dr. Donald Kwolek, and our present Chief Health Officer, Dr. Lawrence Sands. All unique individuals, all very different, but all with the same goal: to protect the health of Southern Nevada residents who live here and the tourists who play here. Born on a Wisconsin farm in 1927, Otto Ravenholt joined the Army in 1945 as a linguistics specialist and wound up working with the predecessor of the National Security Agency as an occasional spy during the rebuilding of Japan and the buildup to the Korean conflict. After his stint in the military was over, he entered medical school at the University of Minnesota. And it's lucky for all of us, he did.
So I graduated this university there, went to Topeka as health officer, had a good 3 years there, and then, as I mentioned, Dr. Farnsworth at the new Board of Health here in Las Vegas had hired to do a review of their situation. He was health officer in Maricopa County in Arizona. Had done a blueprint of what they should plan if they're going to have a good public health department. And I encountered him back in Wichita, and he persuaded me I should visit Las Vegas and look at the operation here. And they sent me an invitation, and I came out, and indeed, this was an interesting crisis, you might say. I mentioned to you I got a telephone call from the then state health officer telling me, advising me I should not get involved in Las Vegas, that I would have a bear by the tail, and they had already ruined one health officer, and that was what would be waiting for me.
And it was soon apparent to Ravenholt he wasn't in Kansas anymore.
It was, you might say, somewhat of an amoral atmosphere for some of them, where the rules weren't the reference point, the friends were the reference point. And you treated your friends well.
And in the early 1960s in Las Vegas, friends could have a whole different connotation. The community Dr. Ravenholt inherited was a free-for-all run by individuals and personalities, not corporations. Rules, if they existed at all, were meant to be broken, whether about the lagoons or open sewage ponds each strip hotel used, or the questionable food handling methods.
As you know, the casinos were very personally managed, if you wish, and they were not corporate ventures, really. And so the whole atmosphere was quite different. Let's say some of the operators were not accustomed to meeting certain rules of how to do business, speaking of the kitchens. And we encountered the one hotel that had sort of its own infamous history. And I ended up issuing them, asking them to appear with several of my board members to explain why things were in such a mess. And the people that appeared were a cook and a busboy. This was a major hotel casino, and we issued an ultimatum that we would close the kitchen on Monday if it wasn't remedied. Then they brought in some crew from LA to help put it in order. But indeed, this reflected a bit of Wild West history of Las Vegas and how business was done.
One of the first tasks facing the new chief health officer was creating a physical home for the agency large enough to serve the community. And in August of 1965, the Shadow Lane campus, now named for Dr. Ravenholt, was opened.
That got underway as a new quarters, so it took a couple years. But so the health district got constituted in a much better situation, and we variously took care of the public health problems.
A career as full and varied as Dr. Ravenholt's can't be summed up in a few sound bites. So as our season progresses, we will bring you more of his insights and anecdotes as they relate to specific departments within the health district. How pasties, not the food, the fabric, led to the creation of the county sanitation district. Or a grocery store receipt established the current financial structure of the district. Or how the deadly MGM fire changed emergency response forever.